Hello and welcome to the Maternal Health Education Project. I'm Sara Vargo. I'm a junior at the University of Michigan.
And I'm Mina Nielsen, a freshman working on this project, and we are from Worth, a student org that focuses on confronting issues in women's health and working towards enacting change. The goal of our project is to improve pregnancy and birth outcomes by making maternal health resources more accessible and easier to understand. In today's video, we are focusing on maternal and perinatal mental health.
We are joined by Dr. Samantha Shaw, a board-certified psychiatrist at Michigan Medicine, who is an expert in women's mental health and perinatal psychiatry. Dr. Shaw is a member of the faculty team for the Zero to Thrive Perinatal Psychiatry Clinic and is also very involved in the education of healthcare providers. I'm sure that we will be learning a lot from her today. Thank you for taking the time to join us, Dr. Shaw.
My pleasure. Thanks for having me.
To start off, I think we were just looking for an introduction to some of the reasons why women might struggle with health, with their mental health during the perinatal period.
Sure, that's a good question. I think that really we can divide it into a couple of different categories. There's the physiological changes that happen during that time, which are really significant, and I think some people maybe know a little bit about, but then there are also a lot of social and psychological issues to think about. So starting off with just the social context of the perinatal period, we know that things are really different now from the way that they used to be back then when women lived in, hundreds of years ago when they lived in small villages and a lot of their extended family members were there to help out with childcare or just supporting them through the perinatal period. And now sometimes people are moving completely across the country from their families to pursue different jobs or education. And this can make it really challenging to find a support network of people to be able to help with those things during that period of time. And so a lot of times people are feeling pretty alone and isolated, and that can make it a real challenge because for people who haven't had a child before, taking care of a newborn all day can seem like something manageable and not challenging, but it can really take up a lot of your time and be quite taxing and find it hard to even take care of yourself sometimes or take care of your household. So it's a really big endeavor. Also, women a lot of times now, as opposed to even 50 years ago, are finding that their careers are really important to them, and it can be really hard to find a balance between motherhood and trying to have goals and accomplishments in your career. And so they're really struggling sometimes with finding a way to feel like they are accomplishing what they want to accomplish, both as a mother and a professional. As far as the psychological impacts, there's also a lot of changes involved with becoming a mother for the first time or to multiple children. You really have to grapple with what parts of you are making you you and you have to attend to outside of being a mother. And a lot of women are dealing with that classic mom guilt, being really hard on themselves for taking times to do things that they really enjoy doing that maybe take them away from their children. But not attending to those things can really lead to depression, anxiety, and just feeling really burnt out. And so it's really important to think about those things and make time for those things. There's also a lot of pressures from the media about the ways that we can give birth, whether or not we should breastfeed, how we should parent. And when women feel like they aren't in alignment with society's expectations or even their own expectations about how to accomplish all of those things, they can feel really self critical, and that can lead to anxiety and depression as well.
Thank you for sharing. That was an awesome overview.
Sure. As far as the biological aspects, as if the psychological and social weren't enough, there are so many different biological changes happening during that period of time. So we know that as far as really important hormones like estrogen, progesterone, even some of our stress-related hormones, that all of those really increase throughout the course of the pregnancy. And then right after delivery, they drop at incredible rates. And so those drastic, rapid changes in hormone levels can certainly have a huge impact on people's mental health. Furthermore, people have gone through a lot physically, whether they've had a vaginal or a C-section, and certainly different complications that might come up with those can cause a lot of pain and discomfort. And we know that increased levels of pain are associated with worsened depression and anxiety at times, and that also can get in the way of women being able to take care of their infant in the way that they'd like to, which can also make them quite hard on themselves and feel upset by their circumstances.
Okay, wow, as if that isn't enough to think about, could you speak a bit about how mental health might be affected by infertility or unexpected pregnancy?
Yeah, that's a really good question. I think a lot of times people think about pregnancy and postpartum as entities in and of themselves and don't think a lot about the journey that people might have taken to getting there. Um, Things like infertility can be really challenging. They can be a really long road filled with a lot of suspense and worry and frustration. And that can really set the scene for the way that the pregnancy or postpartum period is experienced. So, women who have taken years and years to become pregnant through infertility, understandably, might have a lot of anxiety during the pregnancy about whether or not they'll lose the pregnancy. And then in the postpartum period, might be pretty hard on themselves if they find that they're feeling frustrated or not as joyful about some of the really difficult parts of having a newborn as they thought they would be. And certainly, if a pregnancy is unexpected, that brings on a whole other level of having to psychologically figure out how you are going to deal with the stresses of the pregnancy and postpartum period. Um, and certainly, in addition to those two issues, having a history of pregnancy loss certainly can also influence mental health in subsequent pregnancies, as people then a lot of times become much more worried about, understandably, the health and safety of the pregnancy and whether or not they'll be able to carry it to term.
Are there ways in which people's stressors or concerns might vary throughout the course of the pregnancy?
Sure. So, like we talked about, before pregnancy even begins, a lot of the stage can be set sometimes by things like infertility or a history of pregnancy loss or even just difficulty getting pregnant initially. Um, but after that, the first trimester has a lot of specific concerns because a lot of women know and understand that this is the time when, if someone is going to lose their pregnancy, that it will happen. And so there can be a lot of nervousness about whether or not someone might have a miscarriage, particularly if they have a history of loss already. There's also the question of first trimester screening during this time. So, a lot of new blood tests have become available that can give you information about whether or not your child has a high risk of having a genetic disorder or what the gender of the baby might be. And so, women can sometimes have difficulty making a decision about whether or not to get the testing in the first place and then what to do with the results of the testing if there's an abnormality that does come up. There can also be quite severe nausea that can come up for women at this time. And certainly, hopefully, in most cases, it's mild to moderate. But if it is quite severe, there can be trips to the hospital involved. People might have to take time off from work. And that can be really stressful, especially if they're really trying to save up their time for postpartum breaks from work. There can also be a lot of fatigue, understandably, associated with this, particularly if people are quite nauseous. And all of these things then can make the first trimester challenging. In the second trimester, people usually feel a little bit less nervous about the risk of having a miscarriage because the risk of this does drop. A lot of times, people can feel physically a lot better because nausea usually decreases significantly at this time. The anatomy scan, though, usually happens at 20 weeks. And this is when people have a really detailed ultrasound where people can look at all of the different structures of the baby's forming body and determine whether or not there are abnormalities or defects there. And women can get understandably nervous as the date of this ultrasound approaches. And certainly, if there are abnormalities detected, this can be stressful as a woman tries to figure out how serious these things might be and whether or not she might want to make a difficult choice about whether or not to continue on with the pregnancy. Finally, towards the end of the second trimester, people are really starting to feel the baby kicking and moving a lot. And this can be really reassuring for women. But for other women who maybe have had a history of loss or who tend to be a little bit more nervous or anxiety prone, they can get really worried about whether or not they are feeling the number of kicks or movements that they should. And a lot of OB-GYNs will actually counsel women to do kick counts on a certain frequency or basis, where a woman is asked to count the number of kicks that she feels from the baby over a certain time span. And if it's below that number, a woman might be more concerned or be inclined to then call her OB-GYN and have some further testing. So this can sometimes be stressful for women who, again, have had a history of loss or who tend to be a little bit more anxiety prone. During the third trimester, kick counts sometimes can still be a little bit of a stressor as they're still thinking about the movements of the baby and feeling those. And also sometimes movements can become a little bit decreased in frequency towards the end of the pregnancy just because the physical space available for the baby is a bit less. So they're kind of cramped in there and not as able to move around as freely as before. Women who are more nervous about labor and delivery can start to get a little bit more anxious towards the end of the third trimester as they're anticipating giving birth. And also, women can start to get pretty physically uncomfortable and tired at the end of the pregnancy, understandably. And this can be another stressor as well. So, lots of things to think about that change and sometimes stay the same throughout the course of the pregnancy.
Are there mental health issues that can come up related to the birthing process?
Certainly. So we all hope that the labor and delivery goes smoothly and that there aren't any issues there. But certainly, it's a complex biological process that happens, and a lot of things are required to make that happen smoothly. And sometimes our bodies end up not being able to do it all on their own, and sometimes we need some intervention from medical professionals. So, this is something that can be scary and stressful for women because they're worried about their own bodies, their own health during this time, as well as the safety of their baby. And so it can feel really scary if things start to go wrong or feel out of control. And this is particularly the case for women who have a history of trauma. So we know that at least 1 in 5 women has a history of childhood trauma, and a lot of women also have a history of sexual assault, sexual abuse. And certainly that's not everyone, but for the women that that does apply to, this can be an especially scary time. We know that people who have a history of trauma and who have symptoms associated with that history of trauma, a lot of times have that because of a couple of different environmental factors that happen around the time of the trauma and the way that they experience it. So one of the foundational things that is integral to many people's experiences of trauma is this idea of a loss of control, as well as a sense of significant threat to their bodily or emotional health. And so this is present during times when people experience childhood abuse as well as sexual abuse or sexual assault. And unfortunately, this is something that can kind of be recreated during the labor and delivery process, where they're feeling like they're not completely in control of what's happening to their bodies, and where they feel like either their life or their baby's life could be at risk. And so these experiences, so for people who have a history of trauma and then have a scary labor delivery, we know that this can reactivate previous memories and experiences of trauma, as well as create new symptoms associated with a traumatic experience of labor and delivery. So it's really important that women think a little bit about their own history of trauma and ways in which this might get activated. And we can't always predict these things, but ways in which it might get activated during the labor and delivery process. And think about how if at all, there are ways in which they could speak to their healthcare team about their history without necessarily going into too much detail if that's not comfortable, and how to make this potentially a more comfortable experience for them in the event that something does go wrong.
Do you have any specific recommendations for addressing these potential issues?
Yeah, so I think that really having that discussion with the healthcare provider is a good thing to do so that they can, even if they're not going to be the provider who is delivering them on the day that they do go into labor or are induced or have their C-section, that it's documented in their medical chart that they do have a history of trauma. And expanding on that, the patient should really think a little bit about what are some reasonable ways in which they could ask the team taking care of them during that time to help support them with that. So, are there certain things that would really make them much more comfortable during the labor and delivery process that their health team could be on board with? So, for example, if they have a history of sexual abuse or sexual assault by a man, would they feel more comfortable not having any male providers? Or would they like to have a lot of control and discussion about when a vaginal exam is going to be done to maybe assess dilation? So there are a lot of things that can be done to help them feel a little bit more in control during that time. And also even thinking about, are there ways in which they do or don't want to be touched by providers during that time? So certainly we have wonderful nurses and doulas and midwives who sometimes might do things to comfort a woman who appears to be in distress in labor and delivery, but those things might feel more invasive to a woman who has a history of trauma. So thinking really carefully about what things would make them more comfortable and what things would make them less comfortable, and being able to communicate that with their care team would be really important.
What might pregnant people expect during the postpartum period in terms of mental health?
Sure. So, like we talked about before, there's so many changes that happen with becoming a mother for the first time or for, the umpteenth time. And we know that a lot of times when people struggle with mood or anxiety postpartum, it can be related to some of the things that we talked about before. So, for example, whether or not they have support systems in place to help provide them with emotional support or helping them with childcare so that they can take a break and take care of themselves. They may also be struggling with guilt or disappointment about the way that their labor delivery experience went, or they might be struggling with the same about the way that their breastfeeding experience did or didn't go. We also know that because of just the stress of sleep deprivation, even, it can make it so that women are more vulnerable to becoming sad or tearful or anxious, and that these stressors can put some stress on their relationships as well, as they're trying to figure out how to divide responsibilities with their partner, as they're figuring out ways to get the support that they need from their partner, as their partner is also potentially feeling a bit under pressure as well, as they're trying to manage helping their partner and dealing with their own professional responsibilities. So there's a lot that goes on during this time, including what can be financial struggles as well, as all of a sudden the needs are increasing in terms of diapers and all of the things that are required for taking care of a baby. And then, as far as worry and anxiety, a lot of women can understandably feel worried about the safety and health of their newborn. So, a lot of people are aware of the risk of SIDS, or sudden infant death syndrome, and this is a really scary thing for moms to worry about. And sometimes that worry can start to feel really overwhelming and intense. There can also be concerns about whether or not they're bonding with their baby and what that connection feels like. And also, as people are more and more aware of the normal growth and developmental milestones and working closely with their pediatricians, they can sometimes become worried about whether or not their baby is on track in that way.
So, you've mentioned different stressors during the perinatal period. What kinds of things should people look out for to know when they should contact a provider about what they're feeling?
Sure. So there is certainly a lot of stress that people are dealing with. And I think it's important to know when these may be more typical transient things that people are struggling with, as opposed to when they're becoming a little bit more intense and making it hard for them to do the things that they want and need to do. So, depression and anxiety are some of the most common things that people might struggle with in the perinatal period or the postpartum period. So, these can happen at any time throughout that course. And so, in terms of when to think about reaching out for help to somebody, they should really start to think about um, their functioning. And so, are they able, again, to do the things that they want to and need to do? Or is it, depression, low mood, or worry making it hard for them to do those things? Also, are they having significant sleep difficulties because of their symptoms? Are they having insomnia related to their low mood or related to their anxiety, which is certainly difficult to deal with in any case, but when you're also dealing with sleep deprivation because of having to wake up with an infant, insomnia can be really, really tricky. Also, if they're finding that they're not able to experience joy in the way that they are used to, so not getting as much enjoyment out of things that usually they would enjoy, whether it's their baby or things that they would do with other people or on their own, whether it's because of just feeling sad or feeling worried. Also, if they're having really intense feelings of guilt, feeling really critical of themselves, feeling really upset about the way that things may have turned out with relation to the labor and delivery process or breastfeeding, that can be difficult. If they're finding that all of a sudden they have no appetite and this is persisting for a long time, or maybe they're significantly overeating because of stress or low mood. These are all things to think about, as well as if they are having so much worry that it's hard to focus on or think about other things, or if the worry is making them physically ill. Sometimes when people get very anxious, they have low appetite, they can have headaches or stomach aches. So all of these things, certainly if they persist for a week or two, can be quite problematic and reason to reach out to a healthcare provider. And certainly, another symptom that is of great concern is if women are having thoughts of wanting to harm themselves. This can be an unfortunate but commonplace symptom of depression or very severe anxiety. And that would be something to really emergently reach out to a healthcare provider about if you've not already established with someone. Um, Another thing that is important to know about for women is something that we talk about and call intrusive thoughts. So, intrusive thoughts are times when women might have thoughts or images that flash through their mind of either unintentionally or intentionally hurting their self or their baby. And as scary and stigmatizing as these thoughts may sound or be, they're actually relatively common. And it's really important that women talk to their healthcare providers about these thoughts, because usually they are a signal that stress is really high or depression is really intense and that they're needing help and support. Some women are worried that if they share these thoughts or feelings with their healthcare provider, that their provider will hospitalize them or take their baby away from them. This is not the case. Um, in these situations, women are actually not at any higher risk of harming their baby. So these thoughts are really just sort of randomly generated by their brain, usually times during times of higher stress. But the women are not actually, in most cases, at any higher risk of harming their baby despite having these thoughts. So really important to know when you're having these thoughts to reach out for more help and support, because usually they can be addressed by getting that help and support, getting some more rest, and speaking with a mental health provider. So again, intrusive thoughts are something that are quite common, actually, that can occur both during pregnancy and postpartum. And we really want to work to destigmatize these, because a lot of times they aren't talked about because of the stigma, which then makes it so that women who don't know about them and have them feel extremely distressed and upset. And so we want to make sure that people know that these thoughts aren't necessarily dangerous, that they're not going to get in trouble for having them, but that they are an important marker that it's probably time to reach out to someone and get some help.
So you've mentioned reaching out to a healthcare provider when having the symptoms that we've just discussed. What can people expect when they do reach out to their provider?
Sure. So I think the first thing to recognize is that a lot of women can feel ashamed or embarrassed about their symptoms and be hesitant to reach out for help. And certainly, society has come a long way, and there has been stigma in the past, but a lot of healthcare providers are much more aware now of mental health issues that can arise during this time and how to respond appropriately when women bring those concerns. In addition, a lot of organizations are actually providing a lot of different healthcare screenings throughout the course of the pregnancy and the postpartum period to help identify women who are maybe having a little bit more trouble. Many OB-GYNs are actually doing check-ins in terms of questionnaires and things like that throughout the course of the pregnancy and the postpartum period to get a sense of what women might be struggling more with mental health issues. And so a lot of them are really ready and waiting to talk to women who identify or who are identified through some of this screening as having mental health concerns. If and when women go to a healthcare provider to talk about these concerns, a couple of things might happen. The healthcare provider might decide that they feel comfortable managing those concerns by themselves and talk to a woman about her treatment preferences, which might include anything from just psychotherapy to psychotherapy and medications. It really depends on the patient's preferences and the severity of their symptoms. For more mild symptoms, psychotherapy might be a really good place to start. And if people are having more moderate to severe symptoms, sometimes starting a medication makes a lot of sense. The provider might also decide to have a social worker speak to the patient and connect them to appropriate resources. Social workers are very good at talking to patients about these concerns and connecting them to the appropriate resources. And in general, for patients who have more mild to moderate symptoms, we might recommend just psychotherapy. So that might be individual psychotherapy, talking to a therapist about how to manage some of these concerns and symptoms that they have. It might also include working with a group therapy setting. So because this can be a really trying time when women might feel really lonely or alone in their symptoms, it can be really great to engage with a group of women who's going through similar things so that they feel less alone and more supported. And so that can be an extremely important resource for many women going through anywhere from more mild to moderate to severe mental health concerns. And then, of course, if someone is having more moderate to severe symptoms, they might be referred to a psychiatrist, someone like me, who could continue to kind of build on the treatment plan that they had maybe started with that initial provider, whether that be a different kind of therapy or additional kinds of therapy, or even thinking about starting a medication or using some adjunctive alternative measures. So things like vitamins and supplements, exercise, things like that. So there are lots of different ways in which treatment can kind of be catered to the severity of a woman's symptoms as well as her preferences regarding treatment. So I think the important thing to know is that in the vast majority of cases, many providers are more and more aware of and able to respond in a really supportive and healthy way to women and their concerns about their mental health during this time. And so usually should help women to either start on a treatment plan for helping to manage these symptoms or connect them with someone who can if they feel like they don't have the ability to do that at that time.
Awesome. Well, we really thank you so much for helping us make this information more accessible. I know I learned a ton, and it'll be really helpful to have a resource out there where this information is outlined. Thank you so much again. We really appreciate the valuable work that you do in medicine and education here with us.
Thank you so much. Thanks for having me.
We hope you enjoyed this video on perinatal mental health. You can find more maternal health information on our channel, the Maternal Health Education Project. Thank you for watching.